Salut. Pardon for the wait. I just had to finish the previous examination, but now I'm all yours. Je m'appelle Dr. Gérard. Oui, Gérard Poulet. Oui, I am the doctor here, and may I know what brings you here today in my small ASMR clinic? Oh, yes. And when was the last visit? Let me just take a look at my records again. Just need to make sure. Oui, I see. So, since the last visit, did anything happen to your health? In general, how are you feeling? Is everything okay? C'est magnifique. Glad to hear that. Let me just write it down. And we start the examination. Where are my gloves? Oh, in my pocket. Alright. May I ask you just to sit a little bit closer to me? Like so, perfect. Just a little bit. Wait. Alright, let me just see. Your ears. Alright. First of all, I'd like to take a look at your ears. Oui. Up close. Yeah. With my 4 eyes. But before I really want to put the gloves on. Here they are. Alright, where is my... Here it is. One moment, s'il vous plaît. And your beautiful ears. First things first, I'd like to take a look at them. I'd like to see if everything is okay with your left ear. I'm looking for the bumps and lumps and dryness and any signs of infections or maybe inflammations. But I don't see them at all. That is a good sign, actually. C'est magnifique, I would say. Alright, and then just need to take behind your ears to see if everything is okay there. Looks good to me. And now your other ear. And just once again, I'll be looking for the bumps, lumps, and so on. And actually, there are no bumps here. That is a good sign. And no signs of infections. Infections. And no signs of inflammations. And no dryness. No signs of blood. I mean, dried blood and stuff like that. That's very, very good sign. So, perfect. C'est magnifique. Can you just hold still for me, s'il vous plaît? Oui. Now I'd like to take a look inside your ears with my otoscope. here it is. And again, I'll be examining your ears this time inside, and this is gonna be, let's just say, ticklish. Oui, but you've got this. Yes, as I said, can you hold still for me? Very, very still. Yes, let's start with your, I don't know, left ear. Oui, let's take a look inside. C'est magnifique. Let me just take a look inside. Alright, what can I see here? A little bit of earwax, but it's completely okay. No, we don't need to remove it for now. We don't need to remove your earwax, but if there will be any problems with hearing and so on, you just let me know. Oui. And if you need to clean your ears, you don't want to do it yourself, for example, just come to me and I'll help you. No problem, my dear. So, there is nothing, let's just say, awful inside your ear. Let's move on to the next one. Oui, just hold still. C'est magnifique. Alright, what do you have inside your right ear? And I guess the same picture for me, just a little bit of earwax and nothing at all. Yes, and I'm looking for something suspicious, but I don't see it at all. Just a little bit of earwax, as I said, and nothing else. Alright. No signs of dried blood, infections, and so on. Just a healthy ear. Oui. Ça va. Alright. So let's move on to your hearing. Yeah. Let's start with the whispering test. Yes, let me just explain. I'll be whispering. Oui, whispering. Like so. Very, let's just say closely to your ear. Yeah. Right next to your ears. Like so. I'll be whispering the numbers. Yes. And all I want you to do, just repeat the numbers back after me. Yes. This is a very, very simple test. Oui, let's start with your right ear. Alright. How well can you hear me? How well can you hear me? Yes. This is good. Alright, my dear. Just listen to me. The first number is 14. Correct. The next one, 28. Brilliant. And the last one, 36. C'est magnifique. Let's move on to your left ear. Oui, just listen to me very, very thoroughly. Alright. One moment, s'il vous plaît. To write everything down. Oui. Just in order to keep all the information about your health in your file. Oui. And let's move on to the next tests. And yes, this is it. Alright, let's leave it here. And now I'd like to take a look at your beautiful eyes. Up close, like so. Yes, like so. Perfect, perfect. Can you just look at me? I need to take a look at your eyes and see, are there any problems? Yes. If there are any problems with your beautiful eyes, and so far so good. Yes, perfect, perfect. C'est magnifique. Both your left eye and your eye, right eye. Alright. That is good. I need my flashlight with this small lens here. Now I'll be looking at your eyes very, very up close. Yes. Can you just look at me or at the wall? Yes, at the pictures, for example. We just look at my forehead or at the wall. Try to focus on the one thing. I need to check your pupils. Yes, and the bottom of your inside. We just hold on for a moment. Yes, just keep looking there. You're doing absolutely amazing, my dear. Perfect. C'est magnifique. Oui, and once again, just here and there, here and there. Can you look up for me, just for a moment? And can you look down for me, please? Good. And now please look to your right, which is my left. Oui. And now to your left, which is my right, which is my right. Absolutely amazing. Can you look at me? Yes, keep looking at me. Can you open your eyes? Real close. Let's just say, sorry, it's been a long day. Can you just open your eyes real wide? Yes. Perfect. C'est magnifique. Oui. Keep your eyes opened. Oui. And just, yes. And can you do, yes, that is it. Can you do it again? But now this time I want you to look up for me. Yes, keep your eyes opened very, very wide and try to look up. C'est magnifique. Yes, I know. This is very, very uncomfortable, but I need to see if there are any dryness the next test, I'm gonna need this little shiny hammer, and I want you to focus on the tip of my nose. Yes, and I'm gonna be shaking this little hammer like so, and all I want you to do, just tell me, can you see the shaking? And now just point with your finger. Which side is it? Yes. Are you ready? Look here, and let's start. C'est magnifique. Brilliant. Ça va? Oui. Just point with your finger. That is great. Now we are going to do the same, but I want you to cover one of your eye like so with your palm. C'est magnifique. And just keep looking at my nose. Can you see the shaking? How about that? And here. And here. Once again here. And there. Brilliant. Now cover your other eye. Yeah. And keep looking at the tip of my nose. C'est magnifique. Can you see it? Yes. Can you see it now? Perfect. How about that? Oui. And how about that? And once again, keep looking here. It's okay. And perfect. And now I'm gonna need the flashlight. Oui. And in the end, I'd like to shine the light in your beautiful eyes. Yes, just don't look at the light. Oui. Otherwise, you'll have some blind spots in your eyes, and we don't want that. We don't want that at all. We just keep looking at my wide forehead or something else. You're doing absolutely amazing. So, that is actually all for the tests. Yes, yes, you can sit like you said before. Oui. And all I want to do just write down all the results. Oui. And the result of the examination is the following. Your ears and eyes are absolutely perfect. Let's just say c'est magnifique. Oui. And you're healthy. Oui. I would say rendezvous avec la mort is not your option at all. Oui. Alright. Let's leave my signature. And that is it. Take your file. Yes. You need to give it to the nurse. Oui, oui. And that is all. No problem. Anytime, just visit my little clinic if you want to check your health and something like so. Oui. Au revoir. See you. Take care. Oui. Thank you.